How does the CNA exam work? A visual guide to the written and skills CNA exam through Prometric. A presentation brought to you by 4YourCNA.com. So you've signed up for the CNA state exam, but you don't really know what to expect. And you're probably worried about passing.
Is the test hard?
Many testers want to know.
How many steps can I miss and still pass?
And the answer is, it depends.
Wait, what?
In order to understand, I need to explain how the test is structured. On testing day, you will generally be testing with many other individuals. First, the Nurse Aide Evaluator, or NAE, will check you in and verify your identity. The Nurse Aide Evaluators will ask you to wait in the waiting room. In Florida, there are 2 RN Evaluators. Other states have 1. In the waiting room, you are not allowed to have any electronic devices, such as cell phones, tablets, or smartwatches. Study materials are also off limits. No books, notes, or flashcards allowed. But there is a way to study. You're allowed to wait in your car after you are checked in. Just make sure that you're in the waiting room at the appointed time. The Nurse Aide Evaluators will divide you up into groups of 2. You will be paired up with another testing student.
Do I get to pick my own partner?
No, the NAE will decide who will be partners for the exam. When you register for the CNA exam, you are assigned a Prometric ID number. This Prometric ID number tells the evaluator what skills you will perform. This is the information the NAEs use to pair you with other students.
So my skills are decided when I register?
Yes, that's correct.
When will I know what skills I have to perform?
Not until you're in the testing room, ready to begin your test. It's just like a work environment. You won't know what skills each patient needs until you start work each day. For the clinical skills test, the evaluator will take you and your partner into the skills testing room. They will show you where all of the supplies are located and how to work all of the equipment. Hospital bed, privacy curtain, bed controls, bed sheets, towels and washcloths, patient clothing and gown, chucks, soiled linen hamper, patient bathroom, patient chair, grooming supplies, basin, soap and lotion, and bedpan and graduate container are a few of the items that they will review with you. You aren't required to remember where everything is. You can ask where to find supplies if you forgot. The NAE will then give the first testing student a care plan. The care plan will list the tasks that you are required to perform for testing. This student will have this care plan for the entire test. The NAE will also read the care plan to the student. The student must follow the care plan exactly and do the skills in the order listed.
What if I forget what the care plan says?
You can look at the care plan at any time during the test.
How will I know what I am supposed to do?
Follow the instructions on the care plan.
Who is going to be my patient?
For the exam, the other testing student is going to be your patient. When you're playing the role of the patient, you will receive specific instructions. It is important that you are cooperative and that you do what's asked of you. You will be acting like yourself. If you are asked to walk, then walk like you walk. Do not act like a 90-year-old version of yourself.
So I'm not supposed to make it hard for the CNA being tested?
That's correct. It's not your job to make anything harder or easier. Simply follow the directions you are given before the skill.
So just be myself? I can do that.
You will be graded by the NAEs on your skill performance. Before you begin, they will tell you how much time you have to complete the 3 skills. The NAEs will use this checklist to evaluate your performance. This checklist is available to everyone on Prometric's website. So if your first skill is measure and record radial pulse, then the checklist for radial pulse would be used to grade your performance. Each of these checkpoints is important. But they don't all count the same. Some checkpoints are more important than others. Let's use mouth care as an example. If you have a patient lying in bed and you're going to brush their teeth, what would be an important safety consideration? Help them to a sitting position, put toothpaste on the toothbrush, put a towel on the chest, or dry the mouth after mouth care. All of these steps are graded on the checklist. But one matters way more than the others. Can you guess which one? Sure, this is a super important step. If you don't put the head of the bed up, the patient may choke. And if the patient isn't safe, nothing else matters. If you have a patient lying in bed and you're going to brush their teeth, helping them to a sitting position is one of the most important checkpoints. So it will count way more than any other step.
So how many steps can I miss?
That depends on how important those missed steps are. Forgetting to use toothpaste or offer a towel is not as important as putting the head of the bed up. So you might miss several minor steps and still pass, but someone else misses just one step and fails. That's because that one step was super important.
How does the NAE decide who passes and who fails?
Great question. Actually, they don't. When you do a step correctly during the exam, the NAE will put a check mark next to the step indicating that it was performed. But if you miss a step or you perform it incorrectly, you don't get a check mark. These items without check marks are called deficiencies. This will be done for all 3 skills you are performing for the exam. When you have completed your exam, your partner will get their care plan, and you will become the patient for the other student.
Will I get the same skills?
You might, but usually not. Remember, the NAE picks your partner. So they try not to pair you up with someone who has the same skills. After both students have completed their skills test, you will return to the waiting room. You will have to wait for the other students to be tested. After everyone has had a chance to take the clinical skills exam, the NAEs will take the checklists into an office. And they will enter all of those deficiencies into the computer. The computer makes the final decision, using an algorithm that takes all variables into account. So the importance of the missed step is calculated into the decision, along with the number of steps missed. This is a complex process, so the computer will decide whether you pass or not, based on the checkpoints that you missed. You will also have to take a 60-question multiple-choice test on the computer. Most of these questions are scenario-based. A single question will appear on the screen, and you will use a computer mouse to select the answer out of the 4 choices provided. You will have 90 minutes to complete these 60 questions. When you have finished the written exam, you will receive your test results. The NAE will hand you several papers. There is one results page for the written and one results page for the skills. At the top of each results page, it will indicate if you passed that section. Further down, it will tell you how many you missed on the written exam. The last page will list the deficiencies from the skills exam. The NAE is not allowed to discuss your results with you. If you passed, your certification will be mailed to you by the state. If you did not pass, you must wait 30 days before retesting. But you can register to retest right away.
Do you have to take both sections again?
No, you only have to repeat the section that you failed, either skills or written. If you pass one section, that passing score will stay in the system for 2 years. You must pass both sections within 2 years to become certified. You should now understand how testing is performed. Additional resources can be found on 4YourCNA.com. We hope you found this guide helpful. Best of luck on your exam. We'd love to know how you do.